If you're ready to unlock more better days, to take control of your health, to push past your limits and unleash your full potential, then you're in the right place. I'm your host, Dr. Jeremy Bettle. For over 2 decades, I've worked with elite athletes and high performers, helping them optimize their bodies, strengthen their minds, and recover from setbacks. Now I'm bringing that expertise to you through the Vitality Collective podcast. In each episode, we'll dive deep into the science, strategies, and real-world solutions you can apply right away. Whether it's enhancing your physical performance, avoiding or recovering from injury, sharpening your mental edge, or simply feeling your best every single day. With insights from top experts and thought leaders, this podcast is designed to help you take action, feel better, and live the life that you deserve. Welcome to the Vitality Collective podcast, where every day is vital. Today I'm joined by Dr. Amanda Scott, a lifestyle medicine physician based in Santa Barbara, California. Dr. Scott's journey into medicine took an unconventional path, studying internationally in Ireland, working in traditional primary care, and ultimately finding her calling in lifestyle medicine. In this episode, we discuss how strength training transformed her approach to health, why behavior change is at the heart of true wellness, and the 6 pillars of lifestyle medicine that can help you take control of your well-being. If you're looking for practical, science-based ways to build lasting vitality, this conversation is for you. Let's dive in. Today, really excited to chat with my special guest, Dr. Amanda Scott. Dr. Scott, welcome.
Thank you so much for having me.
I would love to have our listeners hear a little bit more about your journey, because it was quite a non-traditional journey for a US MD into medicine. So where did it all start for you?
Well, I'm here in Santa Barbara because I came to UCSB as a student to pursue medicine. And after graduating, I was pretty burnt out just from the rigorous studies and decided not to apply to medical school right away. So I went back to Pasadena, did some various jobs. I worked in an emergency room, did volunteering, and my path crossed with another physician who was a USC resident, and she had gone to med school in Ireland. And I did want to study internationally. And when I heard that she had gone to medical school in Ireland and come back to the US, I was instantly just sold. I was like, if I can get to Ireland, go to med school, have both my medical education and international experience, that's what I wanted to do. I just couldn't wait to start my journey. So I lived in Dublin, going to med school for 5 years. And it was just such an amazing experience. I met other people who were interested in similar things, not only medicine, but travel. So that's really where my, I guess you could say, divergent path started, as I went on this international journey where I learned not only about medicine, but how medicine was being practiced in other places in the world and how other people were living in the world. And so that was hugely influential for me. And then when I came back to the US, I came back to Santa Barbara and pursued internal medicine and decided I wanted to do outpatient medicine, which is primary care or working in a clinic. And the path seemed pretty straightforward, that I would get a job at a clinic, work with patients, providing primary care. And, I pretty soon found out, working as a primary care doctor, I didn't feel it was a great fit for me. I couldn't really identify why. I think when you work that hard to get to that place, there's just so many questions. Is it where I'm working? Is it what I'm doing? Is it medicine itself? And I really, I spent a long time, almost 10 years, trying to understand, what's missing from this for me. And how have I worked so hard to get here and still feel like maybe something was missing? That journey then led me to start researching and looking into other types of medicine, other specialties within medicine, and really trying to identify, A, why did I get into medicine in the first place? And B, what area of medicine reconnects me with that passion, with that joy, because all I knew at the time was what I didn't want. And that can be a really powerful place to start. And sometimes that's where change starts, is more identifying what you don't want your life to look like or the future to look like. And then having to sort of take a step back to then create at least an idea of what you want your future to look like. And then you can get into the more details of strategizing and the practical aspects of that, which I did with a physician career coach. And that is how I found the specialty of lifestyle medicine. And that was a huge moment for me personally, because I didn't know about lifestyle medicine. And when I read about it, it was just this sort of quintessential aha moment of, oh wait, this is what's been missing. It's the exact description of what can really help people, and what I've been trying, I think, to do in these visits. And I haven't had the support or structure or understanding to do that. So all that to say that this journey for me, I've learned so much along the way, internationally, locally, at different types of clinics. But at the end of the day, I think it was just following my gut and my instinct and going, okay, something major is missing here and we need to talk about it. And I need to find that for myself. And that so far has been hugely, hugely rewarding at this part of my journey to find lifestyle medicine and then start practicing.
Yeah, that's there's a lot of points I want to unpack there. But just to acknowledge how difficult it is in a high performing sort of role or a high performing area like medicine. It was similar for me in professional sport, is that once you start becoming unhappy with it, as far as society or anyone else knows, you've got the perfect life. You've got the dream job. You've achieved this position. And it's really hard to start questioning that yourself, because everybody's telling you it's a great life that you lead, how lucky you are, this and that. And you get paid a decent wage when you're being able to sort of help some people, but there's something missing. So it takes a lot of courage to really start questioning that within yourself, to move towards what is your own vitality. And so just to acknowledge what you went through, that process, it was one that I went through myself, and it is really difficult, really difficult. So congratulations on that.
Yeah, I think we'll probably talk more about how important coaching is, but I have to say that having a physician career coach was hugely helpful to me, because like you said, there's this idea that you sort of have it all. You're living the dream. You reached all the goals that you have set for yourself, and you're successful. You're doing a great job, and that's being recognized. And so having a career coach, a really safe place to explore your feelings and frustrations, emotions, and really understanding where all of that's coming from, so that you don't suffer from the guilt of going, what's wrong with me? That I'm not just as happy as can be with this life that I actively built. I'm not a passive participant in this life. And so I think it's important to keep understanding that you are not passive. You can use tools and work with professionals to really create the life that you want. And that includes something like career coaching, really, really helpful.
Yeah, I certainly found that throughout my career, having a coach in multiple different areas, from a therapist to a career coach, and also sort of a coach to help me within my career of how best to advance within my career, how best to deal with people within a certain situation. But then where I started finding my way out of sport was when I had coaches who challenged me to go inside and really start looking at what was it that I was pursuing in this very successful, high achieving career. What were the things that I was not getting from that? Maybe I was chasing those things in lieu of not having something else internally. And so it was really interesting as I started pursuing that. My own vitality journey really began, which is what led us both to here.
That's right.
I'd love to understand a little bit about something else you mentioned in your journey there, your experience abroad. What are some of the differences between going over and studying medicine in Ireland versus, going a more traditional US route through one of the med schools here?
Yeah, I think that the timeline for the traditional Irish medical students, they're a lot younger. They're coming out of high school. Some are coming out of college now, but traditionally in Ireland, you make that choice in regards to your professional pursuits much younger. So the timeline is so much longer for them that really the emphasis in medical school is observation and talking to patients. And the practical aspects of entering orders for tests, we reviewed lab results, but really it was just such a deeper understanding of the pathology or how to take an adequate medical history, how to talk to patients. And so that was really the emphasis, was the educational component, the history taking, understanding disease on a really deep level. And then when I came to residency, the medical students who had been training in America, really, I saw that they were very good at putting in orders. They really understood the functioning of an American hospital system, the roles that everybody was playing within the system, and how to do things on a very practical level. So initially, there was this steep learning curve because I understood all the medical components that I was responsible for from just my education, but I didn't understand how to put in the orders or do things on a practical level like the other medical students had going into residency. So I'd say that was one of the major differences. But then, you learn very quickly, very quickly, working 6 days a week, really long hours, all of the practical components. So I'd say, all of the international grads caught up quickly. But that was a big difference, is really the emphasis was go talk to the patients, spend time with them, listen to the words that they're saying to describe their symptoms. And those words, that history will guide the diagnosis. And so that was something that I will forever use in my practice, is the emphasis on listening to patients and using the information that they're giving you. They are telling you, what's going on. And it's up to you to then take your medical expertise to put the picture together in a diagnosis. But really, it's the patient who's giving you the information directly, from the source. And so I think in Ireland, it was really recognized how important that skill is and how much time you should really spend honing those skills as a practitioner.
Yeah, I mean that becomes immediately clear then where that dissonance started rising for you, right? This is how you've learned to do medicine, but then you enter a system that is very much geared towards feeding the system, right? It's not necessarily patient first, right at the center of everything we do. And so where your training isn't matching up with your work environment, I can see how that would be very challenging. And as you make this progression through to lifestyle medicine, I think there's some other areas that we've talked about before in your history that really made that a natural transition, right? You've been a lifelong runner for one, so you've been very physically active throughout your life. And then your studies at UCSB, studying anthropology. Can you speak a bit to the influence of those two things in how that's shaped you as well as the foreign studies?
Yeah, so I'll start with anthropology, because that's been probably the most surprising thing for me, because it feels very natural to talk about exercise. It's something I've always done. But I had this realization one day as, I'm learning more about lifestyle medicine and how to be a lifestyle medicine specialist. And it's really understanding the human body and mind and spirit, in a sense, with the understanding that we are not actually designed to live in this world that we have created. Our tastes, what drives us previously was beneficial from a survival perspective. And unfortunately, those same instincts, those same, satisfying tastes that we enjoy, are now actually at the basis of a lot of medical pathology, most medical pathology. And so looking back at my studies and the fact that in college, I really was interested in understanding humans and the history of humans living as hunter-gatherers, understanding human behavior from that perspective was just fascinating to me. It was almost like the biggest hack, going, okay, jealousy, how does jealousy work to our benefit? And so I think for me, realizing that that's where a lot of my interest in the university started, and that in a way I've sort of come full circle because I'm understanding us now with that in mind. So it's just fascinating to me that that's where I started at UCSB, and that's kind of where I've come back to, is understanding humans on that level. So it's pretty interesting to make that connection.
Yeah, really fascinating. I love thinking about that from an evolutionary standpoint, and really being able to understand then the mechanics of how people are ending up in the disease states that they're in.
Mm-hmm.
If you look at the activity levels of not even that many generations before where we are now, and the diets and all these different elements, I really think that starts to paint a really clear picture of where we're at.
Exactly. Yeah. So I had that realization one day. I don't know when that was. It's within the last, even just three months or so, thinking about my degree in physical anthropology. And I was pre-med, obviously, with the intention to go to medical school at that time. But the fact that I decided to be a physical anthropology major, I think said a lot about me.
And what about the exercise background from your experience then? Because you were pretty deep into running.
Mm-hmm.
You I think told me on our last conversation you actually don't have any memories of you not running.
That's true. I started running in track and field at the age of 10.
Right.
And my parents are runners. They've always been runners in my life. And so it was a natural thing, I think, to go out for the track team. And then I happened to be really fast. And so it was fun. I could go out there and win races at a young age. And it was, it builds your confidence and you're on a team. And so that was my introduction to running. But I truly don't remember not having that in my life. And then I got into cross country, which I also am thankful for because it's a natural way to continue running as an adult. Some adults might go out and do sprints, but, most adults that I know who are runners will go out and run, longer distances. And so it then taught me how to run longer distances. And pretty much I have run almost every other day, about 3 to 4 miles my entire adult life. And that has really been, it sounds dramatic, but a savior for me, because as a medical student and a resident and having children, it's almost like the hormones in your body and everything's like out of place, and you're trying to understand, how am I going to handle all of this? How am I going to manage all of this? You go running, and then, at least for me, it's not that I'm happier necessarily at the end of my run, but it's almost like everything just fits back into place. I feel better. I feel like I can handle it. Okay, let's get on with the next step. So it's a real regulator for me. I really get into space in my head where I have different ideas while I'm running that just pop into my head. And it's just a regulator for me. So I've been a lifelong runner, and I sort of assumed that's what I did. That's kind of one of my defining attributes, was that I ran. And so I injured my knee, as a lot of runners do. I had a medial meniscus tear, and I didn't want to have surgery. I wanted to see what I could do to prevent surgery and to rehabilitate my knee. And that's how you and I met. Was I went to the gym, I had a physical therapy evaluation, was given, a protocol to follow in regards to maybe why I'd injured myself. And then that just opened the door in regards to a whole other area of exercise and fitness that I had never participated in. And so that has just been a huge experience in my life in the last couple of years that I've been involved in strength training. And one of my favorite stories that I think I told you was that my son has a platform bed, or he had a platform bed, and he was little and he wanted me to snuggle with him. And, I'm running all these miles every week thinking I'm in good shape. And after 40, I started noticing that when I leapt off of his little platform bed that wasn't very high, that I would feel an ache. It kind of hurt. And I remember thinking, oh, that's interesting that hurts. And I never said anything, obviously. I didn't say that to the physical therapist or you guys. And I noticed it was almost immediate, within weeks to maybe a month of doing regular strength training, that these random aches I was starting to have in my 40s melted away. And it was like I would leap off of my son's bed and I'd go out and tell my husband, that didn't hurt at all. I feel great. And it was this sort of like a youthful feeling that I could leap and I could do these activities and actually feel better than I did, a couple years ago. So strength training has been just a huge, huge blessing for me. My goal when I entered strength training, because I was asked, what's your goal? And I said, to continue to be able to run. It's a hugely important part of my life. And really, that's my only goal, is to have my knee feel good and be able to run like I have. Right. I don't need to run marathons. I just want to be able to go on a run. And I didn't know it, but it was going to bring all these other benefits to my life, including, more just mobility, like I was saying, jumping down, being pain-free, feeling strong. As I continue to age, it's really powerful to feel stronger as you age. And so that it's just brought me so much. And there's also a community there. You start to meet other people and you see them working out at, various ages, and it's really inspiring. So I really love it. It's hugely important to me.
This is all just absolute music to my ears. First of all, that somebody else started feeling different stuff at 40. So that's very validating. Thank you.
That seems to be, I think, like this natural cutoff where even if you've been active and an athlete or considered yourself an athlete, it's an important time where you start to realize, okay, there's either sort of one trajectory here or there's another. And I'm going to take the one where, I can continue to move and live my life and feel strong and powerful and pain-free, which is amazing.
Yes. I want to pick up on the word that you mentioned there, the trajectory. Mm-hmm. That, for me, we talk about this every day with our clients, right? We see in all the textbooks and all of the stuff that's put out, these sort of rainbow curves, right, that we will decrease by this amount. It looks inevitable. And I think even as practitioners, we sort of unconsciously follow those. Like you said, you run in, you think you're doing the right thing. You are you jump down off the bed and it doesn't feel good. So maybe you start lowering yourself a little bit off the bed. You stop jumping,
Mm-hmm.
right? And I think we can follow those progressions. And what's really powerful about your message there is that it's just so important that if we can keep this strength training going, if we can maintain the strength of our muscular system, the other byproducts, the bone health, the brain health, the heart health, everything that comes with that. And not to mention, there's the thing you love, which is running, and it will also better prepare you for that thing that you love. And so that's why I'm so passionate about this vitality movement that we're on right now. And it's why your work going into lifestyle medicine resonated so much with me. Tell us a little bit about the difference between lifestyle medicine and traditional medicine.
Mm-hmm. Yeah, so that's probably one of the most common questions that I get asked is what is lifestyle medicine and how is it different than primary care or what you've been doing? So the technical description or definition of lifestyle medicine is that it's a medical specialty that uses therapeutic lifestyle interventions as the primary modality to treat chronic conditions, and that includes, but obviously isn't limited to, cardiovascular disease, type 2 diabetes, obesity. And that really lifestyle medicine clinicians are using evidence-based medical practices, but it's focused on lifestyle interventions to treat the whole person. And we use prescriptive lifestyle changes. So we give, not just general recommendations, which I think is more of what I traditionally did as a primary care doctor. You need to eat more fruits and vegetables. You need to be more active. And the recommendations from a traditional doctor, they might be there, but they are not trained in behavior change, motivational interviewing, how to write these types of prescriptions. And so the recommendations stay quite broad. And the person already knows. I'd say almost 100% of the patients you're telling to eat more fruits and vegetables, lose weight, or get more active already know that. It's not news to them. They kind of look at you like, well, yeah, of course.
Right.
So the difference would be that the lifestyle medical professional is going to use their training to really act as a coach. And trust that the patient is actually going to lead and give you the information to follow. So that's a big difference too, is that in traditional medicine, you as a doctor are the expert, you give the recommendations, you write the prescriptions, and you sort of send people on their way. And that's putting it simply, but that is sort of the traditional structure of those visits. In lifestyle medicine, as I said, it's much more coaching based. And so you're really working with the patient to come up with goals. You're writing them down in ways that make sense to the patient and that the patient wants. Because it turns out people don't do things that they don't want to do. You could tell somebody all day to go on a walk, a run, whatever. If they don't want to do it, they're not going to do it. In fact, I think the statistics are that 80% of prescriptions that you write are not adhered to. And it's because, there's various reasons. But at the end of the day, your patient has to believe in that change, believe in the prescription that you're working on together. So it's much more collaborative. It's from the perspective of the patient is the expert in themselves, and they will help guide your recommendations. And so that's a big difference. Lifestyle medicine physicians are not against medications at all, or traditional medicine. In fact, I think all lifestyle medicine physicians, the ultimate dream is that there isn't a difference, that this is an innate part of primary care, and that these conversations actually start at the primary care level for all physicians when they're with their patients.
I think there's Some really important points there, certainly for me around coaching and
Hmm.
collaboration. I've found that too, and it's something that we emphasize with all of our practitioners with Vitality Collective is it's not enough to be a good practitioner anymore. That's sort of entry level. Now we have to move on to be a coach, guiding people through this process because ultimately change is really hard. And you mentioned being a mum, going through all of this, your career and this transition into a new business. Often when your schedule's not your own, what you eat, the environment that you set up, it's not your own. You have stuff in the house to feed other people.
Hmm.
You might want to make this dietary change, but maybe your significant other or your kids need another certain thing in the house or want another thing in the house. So how you personalize this and how you coach somebody through this
Hmm.
process, it just couldn't be more important as a step to get people to ultimately adopt these lifestyle changes.
Yeah, I think, you know, when I look back on my career as a primary care physician, some of the most important moments where I felt like I was really helping and making an impact on a patient's life was when we were talking about um, their 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 actual personal life, what was happening on a daily basis for them. The fact that they did want to work out, they did want to do the right thing, but they didn't have the support, they didn't have the structure at home. Um, maybe they were struggling themselves with depression or anxiety, relationships. It's so complex and so individualized. And in those moments when I felt like I was really helping somebody, those were the kind of conversations we were having. And that's why I think when I found the specialty of lifestyle medicine, it clicked so much for me because it was these are the areas, the six pillars of lifestyle medicine were the areas that patients needed help with. And they were the first ones to say, that's what I need help. That's where I want to go with my health. I want to address those
Mhm.
areas. And the six pillars, just to put it out there, are healthy nutrition, positive social connection or relationships, physical activity, so that's any kind of movement. We specify what type of exercise a person should get based on their age and abilities, but physical activity. Restorative sleep is huge. Stress management, and then avoidance of risky substances. So, those six areas are really the foundation of lifestyle medicine. And I use in my practice those six areas as an initial assessment during my consultation. So, even if somebody feels like they're very active, they don't need any help with their physical activity, I still do an assessment and we take all of that information into consideration when we determine the plan. So that's really the foundation of it. And those are the areas that I found patients really actually wanted help with. This idea that patients want to continue living an unhealthy life and you're not going to get them to change at all is totally untrue. Patients really want help with change. And that's what I've found. And that's where really sort of it's such a special visit or encounter with patients when you help them on a practical level figure out how to make the changes they want. And you can see the hope in their eyes. You can see them get excited. And I had some patients say, I've never had a doctor talk to me about, these things. And it was really special to them as well. So it's so amazing. I'm so excited about this. You can tell. It's just so cool.
Yeah, that's just fantastic, and it really does speak to the importance of those lifestyle behavioral elements to people's health, and those almost exactly mirror our essentials of vitality. We sort of listed intelligent training, conscious nutrition, restorative sleep, emotional and spiritual balance, optimal brain
Hmm.
health, and then proactive medicine. So again, I think what we wanted to position within our essentials is we're not never on medicine,
Hmm.
right? We're not never take a statin. We're not never have surgery, but it's put it all in its right place.
Hmm.
If you're not training, you're not eating well, and you're not sleeping, should we jump right to medication? Right?
Right.
Because you can almost mask the need for the person to actually address the underlying cause. And we sort of term that, we're putting dams on rivers, right? Yes, we can stop that flood coming through, but it's still building up behind the dam, right? And so the dam's got to get bigger and bigger and bigger now, as the lake builds up behind it. And I think that if we can really coach people through these essential elements, and then we find there's still a need for some medication, it's really going to be a powerful implementation of medicine that will actually make a difference that will last versus don't change anything. Here's a drug, off you go. Um, how then do you manage that medication piece? Because I imagine
Hmm.
the need for medication starts falling away. Is that done in collaboration? Is that something that you manage? What does that look like?
Yeah, that's another great question because it does take coordination of care for patients who are seeing me and a primary care doctor. And that's, potentially the goal, whether it's the goal or not, to de escalate medication. Patients might come in on a blood pressure pill, start implementing an improved diet, more fruits, vegetables, more exercise, and start to see their numbers go down. And so, as their lifestyle medicine physician, I'm tracking their blood pressure here in my office and their heart rate. And so it's something that we'll continue to watch. And I would talk to patients about symptoms if they're feeling dizzy or lightheaded. That might be an indicator that your blood pressure is coming down, and I can give them recommendations based on the medication that they're taking. And I can also reach out to their primary care doctor. If they're taking a certain milligram pill, and I know that we can pretty easily reduce the medication simply by breaking it in half. So technically their prescription is the same, but they're taking a lower amount, but in coordination with their primary care doctor. So as a local doctor here for the last decade, I do have a great relationship with the physicians here in town. And I think that, they're almost all of the physicians, they just want their doctors just want their patients taken care of, and if their patient is coming to see me and I'm watching their blood pressure and I'm helping them make changes that the patient's happy with and they need less blood pressure medication, the primary care doctor is just going to be thrilled. Like, great, let's reduce your dose. Excellent, wonderful.
Right, right.
That's great. So I don't think it'll be an issue. So I can make recommendations, but really it'll be in coordination with their primary care
Yeah.
doctor or their cardiologist. And that's also, the conversation with me at the consultation starts with finding out who their doctors are. And so that I can even, proactively connect with their doctor and say, hey, I'm seeing, this patient for lifestyle changes, and just introduce that as one of the modalities of the patient's care. So that then if there are changes that I'm recommending, it's not a surprise. They already know that the patient is seeing me. And it's more just about communication and collaborating. But it's something I definitely will, proactively talk about with the patients and their other providers.
Yeah, that's something else to highlight there. This doesn't replace your primary care physician.
Hmm.
I think is what I'm hearing, but also this sort of relationship exists, right? Your primary care physician will refer out to the other specialties. You mentioned cardiology, but there are so many specialties that you will get referred out to from your primary care physician. This should just be one of those specialties that sits
Hmm.
alongside traditional medicine in a very, very powerful place that can actually help reduce the need for the medical interventions that we would traditionally see put sort of more at the front.
Exactly. Yeah, I think that's going to be shift. I think that in the medical community, at least here, the medical community is still trying to understand where does lifestyle fit into this equation. And I know some local physicians are utilizing lifestyle medicine within their primary care practice. So there's that exists. And then there's also seeing a lifestyle medicine specialist outside of primary care. So that's what I've chosen to do because it's something I'm passionate about. I want to spend my time with the patient, focusing on lifestyle changes that will result in improved health, as you mentioned, de-escalation of medications and things like that. So I think that's something that, will grow with time. The lifestyle medicine is a specialty that's rapidly growing. I think in the next, 2 to 5 years, it's just going to explode, and you're just going to see more and more practitioners, even locally, who are practicing lifestyle medicine and calling it that, not sort of slipping it in here and there, at the end of a visit or within a visit. That with the time constraints, it's almost impossible to adequately do that.
Yeah.
So I think that it's going to become more of a known medical entity. And that's part of my personal goal, is to talk to other doctors about lifestyle medicine so that they really do understand how it functions within the patient's medical care.
Yeah, I think that's so important to understand that it's a part of their care. I mean, we're here in Santa Barbara, so the lifestyle interventions have got to be a little easier, right? Like,
I think so. Yeah.
Get outside, and we can go outside all year round.
Right.
I think you really alluded to it there in terms of some of the limitations that we might see that are placed not on the physician from a desire to interact in this way with their patients, but just from a logistical limitation of the system itself. For me, it seems like more of a how do we fit this into our system, which is incentivized in a certain way, versus what we're currently doing. So I think I'd love to hear from somebody who's been in that traditional element. What are some of the challenges that the internal medicine doc, who is your family physician within one of these big systems, faces?
How much time do you have?
Is that episode 2?
No, it's really, to me, one of the biggest limitations, to sum it all up, as a primary care doctor, was time.
Right.
Between the way that the schedule works on a daily basis, how many patients you're seeing in a day, how quick the visits are. Most primary care visits are 15 to 20 minutes. And those are problem-based visits. So those are, if you have a cough or cold, but most patients have such a hard time getting into their doctor that they will also have other concerns that maybe they've been thinking about or wanting to contact you about. And so the 15 to 20 minute visit is just not going to be adequate to address both maybe the issue that brought them in, and then the other issues that the patient's concerned about. And then you start looking at their chart and you realize, you're behind on your colonoscopy. You didn't get the labs you were supposed to get in February. And, they probably have a good reason. They'll say, well, I was out of town and I forgot, or, I tried and the order wasn't there. That's a common story. I tried, and they do try. And so your 15, 20 minute supposedly problem-based visit turns into actually a fairly complex, comprehensive medical visit, because patients don't have access. They can't get in to see you. And so really the issue is time. So on top of addressing the acute concerns or the other things that's going on in the patient's life that they would like to talk to you about, then you really have virtually no time to get into the nitty gritty of their social connections, which is hugely important in a person's health. In fact, social connection is one of the main factors related to your longevity. But we don't have the time to talk about that because we're trying to put out fires. So there's the time of the visits make it virtually impossible. And I'm talking about visits within like a larger institution or even smaller institutions. But when you have a system like that, you don't have the luxury of time. And then it's the other factor, and why I love lifestyle medicine. At a recent conference, one of the doctors said lifestyle medicine is the antidote to physician burnout, because not only are you from a patient's perspective frustrated because you can't get in, you don't have much time with your doctor. The doctor's frustrated and likely burnt out. The majority of doctors right now are burnt out, and they don't have the emotional and psychological capacity to have some of the conversations you should be having for the patient's health. They're thinking about what just happened, what's going to happen next. They're getting inundated with messages on their computer while they're talking to a patient. It's multitasking at a level that is just unreal. And so it's really difficult. And that's another reason why I've decided to focus on lifestyle medicine right now and not also do primary care. Is I'm making a conscious effort to have that be my focus. This is why we're here. And I think that's really powerful, because it is hard sometimes to, not get distracted by some of the other things that need to be happening in your health. And so that's why I'm saying, okay, this is what I'm going to focus on with you, because I feel this is extremely important for your health.
Yeah. Yeah, I think just the fact that you called it a problem-based visit, for me, highlights the biggest problem with our modern healthcare system is that it's reactive, it's not proactive.
Right.
We think, and we are conditioned to go to the doctor once we have a problem. And I don't think that there's a way that we can end the chronic disease states in that model, because we're waiting for people to already have them before we're allowed to treat them in many cases, right? So, and the number of people that have come and said, okay, I get my blood work done, and every time, okay, everything's good, you're in range, you're in range, you're in range. And then after 3, 4, 5 years of doing that, now you have diabetes. Well, hang on, my last visit, I was fine, right? I was in range, no problem, nothing to worry about. And now I'm on medication. And so I think this style of proactive treatment, of monitoring and creating interventions and coaching people through them really, really is important. And even if we think about what is that suggested range, where do those numbers come from? Maybe you can speak a bit more to this of, like, am I healthy? Like, where in that range am I healthy? Is there an optimal? That'd be really interesting to dig into.
Yeah. I mean, I think that, as a primary care doctor, there were obviously clear cutoffs of, what's pre-diabetes, what's diabetes, what's hypertension, what's your ASCVD score, which is, the cardiac calculation to determine what we should do with your cholesterol panel results in regards to should you start a medication or not. And that's all really, really helpful, and I think necessary. But you also, a lot of these things are red flags, and you see them for years before they fall into a range where they need a medication. Like cholesterol is a classic example where if you're young, your age really offsets the calculation to determine if you need a medication. And so, as you age, that's its own independent risk factor that then is tipping the scales towards a medication. And so it was always an interesting conversation to have with patients, because they're saying, well, last year my numbers, were worse, but now that I'm a year older, you're telling me I need a medication. Right. I was like, well, yeah, you're a year older, but it was like, we could have had so many meaningful discussions about their lifestyle for years. And I was just happy they didn't fall into the range where they needed a medication, and, would reassure the patient, or we could do additional testing like the coronary calcium score, see what that looked like. But, these are conversations that should and could be happening for years before it's an issue. But again, going back to the lack of time, and then also in, most doctors who are going to med school, they're not taking a course on nutrition, a course in regards to exercise, stress management. So those factors, which are directly linked to chronic disease, you aren't going to address them most of the time with traditional doctors. There are some who are trained in it, but that's not common.
Yeah, that's something that we've really found, and something we implemented with the athletes was certainly that regular monitoring. Rather than looking for a range we wanted them to be in, it was a trend. Were they trending in a positive or negative direction?
Right.
That allowing us to make those adjustments because we have the time, we can do that. And that's sort of what we've brought out of sport and into the general population now, is monitoring these things over time. We know what your risk factors are. We know what the biomarkers are that are going to be the red flags you alluded to. And so if we can get a timestamp, which is our big sort of vitality evaluation, and then the pace at which that physiological system adapts, now we can really start thinking about tweaking your program. Maybe it is talking to your physician, but maybe it's going over and seeing the physical therapist or seeing the nutritionist, or working really with people with deep expertise in that area.
Right.
And I think that's such a good point, is that, generally your physician isn't trained in nutrition. So is that person, even if your physician had the time, is that the person you want to talk to about that? Or do you want to go over here and talk to your lifestyle doc or your RD? Right. I think these are really important conversations. Why we use the term collective, right? Because it's not what I know, it's what we as a group know. And are you seeing the right person at the right time? And that for me is certainly how I see the future of healthcare, is that it's not medical care, it's healthcare, right? It's all of us who have our specialties working together to do our piece of it. And if we all attack the same problem from a slightly different perspective and training set, we'll just have this complete solution that surrounds the patient and help to offset the demand that I feel so much for physicians, because they just get all of this dumped on them and are expected to just do all of it, know all of it, and it's a real disservice to people who go into this profession with nothing but wanting to help people, save lives, really change lives, keep families together. So,
yeah. And a thought that came to mind, I think you said something about the timing of it. And that's something I started after, like my 8th year in primary care. I started to really recognize what I would talk to patients about: medical momentum, and say, we have your physical appointment, and that's where we're going to talk about your preventative care, the testing that you are due for, the immunizations, the results. And then you start a discussion about your cholesterol, and then you start to talk about their diet or their exercise. And then you leave it there. And, potentially if nothing major happens, you see them in a year. When in reality, that discussion, a momentum is building. The patient's asking questions. They want to make changes, and they want to know how to make the changes. And when can I see you again? And how can we do that? And you can feel a momentum. And it's a really important time where you want to take that momentum and go with it and go, okay, let's get going with this. You can see them get excited. They want to make changes. And unless you go with the momentum, it's a lost opportunity.
Yeah.
And life takes over. They've got their own huge responsibilities, and another year goes by. So really, working with a group where you can roll with that momentum, go with it, take that energy that the patient has for this topic, and they want to make improvements, and connect them in the way that they want to be connected. It's just such a powerful moment. And I remember patients saying, well, Give me 2 or 3 more months. I'll make the changes and I'll get back to you. But you could kind of see even in that, you were losing a little momentum. And it was like, no, I'm going to see you in like 2 weeks, not 2 months. We're not going to let this moment go because it's a really powerful moment. And so there's something about the timing, the momentum. And once that starts rolling, and when you put all the pieces in place, it's a really powerful place.
Yeah. Yeah, and that's the thing we saw with the athletes. When we put this system in place with the Maple Leafs up in Toronto, we went 3.5 years without having any injuries. And if you apply those principles to the general population, and we're seeing it with our one-on-one clients every day, is that the benefits just compound. It's unbelievable progress they make. Because you're with them twice a week. You're getting to follow up on these things every week. We're having the conversations about, okay, how did it go? Okay, let's change, let's do this. And little things that come up. Oh, my hamstring was a little sore after I played pickleball at the weekend. Okay, let's adjust this, right? It doesn't get to where it's a torn hamstring. It's just so powerful, like watching it happen. So with you moving into this role, I'm really interested in, where can people start, right? What's the conversation that they should have maybe with their primary care physician to seek out lifestyle medicine? Or maybe that's not an option for them and they want to do something at home. What are your big, most impactful takeaways for people to start this change process?
Yeah, I think some of the easiest ways to think about it, and the way that I like to think about it, is people might expect, if they were to see a lifestyle medicine physician, that they're going to be told to cut back, like, oh, you can't eat this, you can't do this, you can't do that, that you'll be deprived of something that you enjoy. And it's actually the complete opposite. It's adding. I want to add to your life. A lot of people are suffering, and when you start talking about what they're doing, they're just surviving moment to moment, whether it's taking care of their kids, going to work. And so I want to add to their life. And some of the easiest ways to start adding foods and movement to your life is to take something that you already enjoy. So say you like apples. A really easy way to start adding more fiber and fruit to your diet is to literally add an apple to one of your meals a day, or add an apple stack. So say you normally have apples with lunch, add another apple or add another half of an apple. Serve it. That's a serving, So thinking of something that you already enjoy, a type of fruit or vegetable that you already enjoy, and adding a serving of that. Another really easy way to add movement is movement you enjoy. So some people think of exercise, and, I talk about running, but a lot of people hate running. They would never, ever, that wouldn't be something I know that they want to go out and do. And so think of movement you enjoy. Even like with kids, a great activity is dancing. So say you enjoy dancing and you haven't done it in years. Literally turning on some music, setting a timer for 5 minutes once a day can not only get you moving, but also reduce your stress, give you, a boost. And so things like that. So I think brainstorming about things that you already enjoy or maybe used to enjoy and how you can bring them back. And so I definitely would say just adding more servings of fruits or vegetables is an easy way to do it. And then trying to brainstorm about movement that you already enjoy. Those are two really, really easy ways to do it. Another thing is mindfulness. There's some really great, very short mindful practices, whether it's, you can do breathing, or you can sit for 3 minutes and practice gratitude. There's also, if that's an area where you want to start exploring that, there's a lot of information online on brief and short mindful practices. So I think those would be really easy ways to start. And then, if you are able to work with somebody who has studied lifestyle medicine, then obviously the way that I would approach it is after evaluating the 6 pillars of lifestyle medicine and determining which areas you want to work on, then I would work with the patient to make really specific goals for each of those areas. And I would only pick 2 areas to start with. I wouldn't, try to make a change in all 6. I would go for the areas that the patient wants to make changes in and start there. And then the beauty of it is that if you pick one area, that's actually going to have benefits in other areas as well. So say you pick stress, that you're really stressed, you really want to become less stressed. And we go through methods to address your stress, and that improves. Your sleep is going to get better. You're probably going to have more energy to be exercising. You might have some more energy to have positive social interactions. So it's all related. So you really can't lose, basically.
Yeah. Right.
Yeah.
Yeah. What a great message. I love that concept. Fits seamlessly into our concept of vitality. It's not about being on a perfect restrictive diet that comes with 50 supplement pills you've got to take every day. It's about loving your life. Our mission is not that you come and lift weights with me. It's that we give you the capacity to do the activities you love every single day for as long as you want to do them. Not, you're 60, you're perhaps a bit old for skydiving. Like, why? Let's train you for the demands of that, right? We can train for that. So I just love that whole concept of not taking things away from people, but adding things they love into their life, especially dancing we now have it officially that an apple a day does keep the appreciate
right. I know that's the quintessential example is an apple a day, and I'm recommending it here.
Right, you heard it here, folks. We have confirmation.
Right.
And are there any questions that you would pose to people, or have people pose to themselves, to consider about their health or their mindset around their health, to shift people in this more proactive direction?
Yes, I have thought a lot about this because behavior change is hard, and you really there's the research that shows, and it's common sense that shows, when you eat healthier and you move better or more often, then you're going to feel better and live longer. But what the real question is, why? What is your why? Why do you want to live longer or feel better, have more life in your years left? Is it because you want to play with your grandchildren or care for your grandchildren? Is it because you want to travel? What is your passion, and why is it important to you? Because I think that it's hard day in and day out to get into the gym, to do the things you need to do. And if you take a step away from the emotions of it, I don't feel like it, or I'm tired, or it's, I'm kind of bored with this. And then you take it back to your why. Well, I want to continue running. I want to be able to play with my kids and live a healthy life. If you can find your personal why and use that as your motivation, you can pull from that. It makes it happen. Whereas if you don't connect with a deeper why, you might not make the best choices in regards to your diet and exercise and lifestyle. So that would be my question, is what is your why? Why do you want to make changes? Why do you want to have mobility as you age and strength as you age. So that would be my question. What is your why?
Outstanding. I love it. And I don't think there's a better way to wrap up than that. What is your why? Dr. Scott, I would love people to be able to find you. How can people either learn more about you, learn more from you, potentially come and work with you?
My website is a great place to start. It has a lot of information about myself as well as lifestyle medicine in general. And you can schedule a free meet and greet where we can sit down and talk about your personal goals and what my practice is like. And that is sblifestylemedicine.com.
Right.
SB is for Santa Barbara, Lifestyle Medicine. And then I'm on Instagram, so that's also SB Lifestyle Medicine. And so you can find me there.
Right. We'll provide links to all of that in the notes.
Thank you.
So everyone can find you, follow you. And we really enjoy following your posts on Instagram.
Oh, good. All right. Well, thank you so much for having me. It's been really fun.
Yeah, thanks so much for coming on. We really appreciate all your insights.
What an incredible conversation with Dr. Amanda Scott on how lifestyle medicine can reimagine healthcare. Here are the 3 key takeaways from today's episode. Number 1, start by adding, not restricting. Whether it's more whole food or more joyful movement, small positive additions create sustainable change. Number 2, find movement that you love. Exercise doesn't have to be a chore. It should enhance your life and support your passions. Number 3, discover your why. Having a deep, personal reason for making health changes increases the likelihood of lasting success. If today's discussion resonated with you and you're ready to take a proactive approach to your health, visit www.vitality-collective.com to explore our programs. Thanks for listening, and we'll see you next time.